Thank you to all the witnesses for being here. And speak to Ms. Schultz. And first, again, extending my condolences as well for Danny and for on the eve of the anniversary of his death. You and the mothers and families know better than anybody how dangerous the toxic illicit drug supply is right now, and what it's like to support someone with substance use disorder. We've seen, the numbers in BC somewhat plateau at about 5% over year in terms of growth in overdose deaths. No growth, no overdose death is good. We've seen Ontario at 6.8%. They also have safe supply there. It's a very small amount in both provinces, less than, I think, 2.5% of people that have substance use disorder. In Alberta, the numbers have shot up 17% in your home province. Saskatchewan, 23%. A neighboring state, Alaska, a Republican state, 45% year over year. They've just surpassed BC for toxic drug deaths per 100,000, and Alberta's on a trajectory to pass BC by June. Can you tell us what's going on in your home province? Why such a spike in Alberta, Saskatchewan, and possibly Alaska?
What is happening in my province is heartbreaking. We've seen a government with a myopic focus on treatment, and trust me, treatment is important. We love treatment. We love recovery as families. But we have to make sure that people are well and alive. And even within that treatment model, it's been in place now. A recovery-oriented system of care has been in place for 4.5 years. Yet, as you outlined, we have some of the highest increases in the country. Yet, if you do seek care, I recently tried to get somebody into detox. You have to show up at detox 3 days in a row at 9 o'clock in the morning to get the person in. Explain that to somebody using stimulants, that you will get up early and go with me 3 days in a row, and maybe on day 3 I get you in. The recovery community in Red Deer has a 6-month waiting list. My dear friend Esther Tailfeathers is from the Blood Tribe in southern Alberta, where the government closed the consumption site. Lethbridge now has a per capita rate that is 3 times that of other community. It was the only site that had inhalation, and more people have moved to inhalation, and we don't provide these services throughout. In southern Alberta, in Lethbridge, the Blood Tribe was promised a recovery community. They have 3.5 years ago, they have one ceremonious shovel in the ground, but no building forward. So not only is there this myopic focus on what is called recovery, but it's in name only. It is actually not available to people who need it, where the drug supply is getting more toxic. And you see it in the increases. For me, the true measure of success of any policy approach is when my friends don't have to arrange funerals. That is a true measure of success. Our board chair, Tracy Letts, is just planning the future funeral for her son. As long as this is going on, the model is not successful, and Alberta's model is failing us. So when people push recovery without harm reduction, without addressing prevention, nobody's talking prevention anymore. I'm glad my fellow speakers have raised this point.